So, good day everyone, especially to Sir Matt. Good day, sir. So, our topic for today is all about psychological evaluation. So, psychological evaluation, it is a way to assess ato kada isa nga batasan, pagkatao on how we interact to our co-people or co-citizens, and also on how we think, how we solve the problem, or so how in a situation, and also to other domains. So, also to seek better to understand the individual's unique characteristic or personality to predict things. So, psychological evaluation it also not only to assess our individual behaviors, personality, cognitive abilities, also in a workplace performance or customer relationship like how we deal to our customer. So, followed by the history. So, psychological evaluation has been around for roughly 200 years. So, back as 2200 before Christ. So, it started in China. Then, the first test focused on aptitude. Then, scientists tried to use mental processes in patients with brain damage, then to children with special needs. Then to be followed by and science psychological evaluation. So, in 2200 before Christ, Chinese government employees were tested every 3 years. So, written exam were introduced in the Han Dynasty 202 before Christ to AD 200. So, there are five topics were tested. So, first is civil law, military affairs, agriculture, revenue, and geography. Next is modern psychological evaluation. So, in 1885, the German physician Hubert von Grachi found that many brain injury patients could recognize stimuli, words, picture, or symbols, and they're totally but could not identify them when shown through the moving slat. Then, German psychiatrist Konrad Rieger developed an excessively ambitious test battery for brain damage. It took over 100 hours to administer. Then, this test did not win much acceptance. Then, Wilhelm Wundt in 1832 to 1920. So, founded the first psychological lab in Germany, Leipzig in 1879. Thought meter used pendulums to assess thought swiftness based on observed versus actual pendulum position in 1862. So speed of thought varies from one person to another. Then focus on human similarity than differences. Followed by Francis Galton in 1822 to 1911. Sir Francis Galton, Darwin's cousin, so a British scientist, applied evolutionary theory to the study of intelligence, which he believed to be heritable. Introduced a measured relationship later called correlation. Believed that intelligence is quantifiable and normally distributed. Known by eugenic movement, selective breeding of gifted individuals. Intelligence and ability to use sensory ability. Use sensory discrimination and RT as test of intelligence in 1883. To be followed by James Machen Cattell in 1860 to 1944. So, si James is American psychologist who worked in Galton in England. Developed a battery of 50 tests to measure mental ability in 1890s. Like Galton, he relied on RT and sensory discrimination. So later, one study Clark Whistler in 1901 contradicted and other supported the relationship between RT and processing speed with academic achievement. So, Cattell introduced mental tests in 1890. So the last modern psychological evaluation is Alfred Binet in 1857 to 1911. So Alfred Binet, a French psychologist, tried to develop the first standard intelligence test. He used tests to identify developmental disabled children from normal school children. The approach was not deterministic but aimed at training those who need help. In 1905, with Theodore Simon, Binet introduced items that are graded according to actual age level. The number of right answers indicated mental age. The next is formal and informal psychological evaluation. So, formal psychological evaluation consists of a standard batteries of tests and highly structured clinician-run interviews. So, and then informal psychological evaluation take on completely a different tone, also based on unstructured, free-flowing interviews or observation provide case findings about the patient that are both efficient and effective. Next is modern use. So, psychological assessment is most often used in the psychiatric, medical, legal, educational, or psychological clinic settings. The types of assessment and the purposes for them differ among these settings. So, within these settings, the psychologists need to be aware of the legal responsibilities that what they can legally do in each situation. So, psychological assessment is used to find the possible underlying psychological disorder, emotional factors that may be associated with medical complaints, assessment for new psychological defected. Psychologically, treatment for chronic pain and the treatment of chemical deficiency. Next is personality assessment. So, personality traits are an individual's enduring manner of perceiving, feeling, evaluating, reacting, and interacting with other people, especially and with their environment more generally. Because reliable and valid personality inventories give a relative accurate representation of a person characteristic. They are beneficial in the clinical setting as supplementary material to standard initial assessment procedures such as the clinical review of collateral information, example, reports from family members, and review of psychological and medical treatment records. Next is pseudo-psychology or pop psychology. So although there have been many great advancements in the field of psychological evaluation, so some issues have also developed. One of the main problems in the field is pseudopsychology, also called pop psychology. So psychological evaluation is one of the biggest aspects in pop psychology. So in a clinic settings, patients are not aware that they are not receiving correct psychological treatment, and that belief is one of the main foundation of pseudopsychology. It is largely based upon the testimonies of previous patients. The avoidance of peer review, or critical aspect of any science, and poorly set up tests, which can include confusing language or conditions that are left upon interpretation. So last is ethics. So concern about privacy, cultural biases, tests that have not been validated, and inappropriate contexts have led groups such as the American Educational Research Association and the American Psychological Association to publish guidelines for examiners in regard to assessment. The American Psychological Association states that a client must give permission to release any of the information that may come from psychologists. The only exception to this are in the case of minors, when the clients are danger to themselves or others, or if they are applying for a job that requires this information. Also, the issues of privacy occurs during the assessment itself. The client has the right to say as much or little as they would like. However, they may feel the need to say more than they want or even may accidentally reveal information they would like to keep private. The validity and reliability of the test being used also can affect the outcomes of the assessment being used. When psychologists are choosing which assessment they are going to use, they should pick one that will be most effective for what they are looking at. Also, it's important for the psychologists are aware of the possibility of the client either consciousless or unconsciously faking answer, and consider use to tests that have validity skills within them. So that's all. Thank you very much for listening.